Welcome to HopeSpoke's psychoeducation video series. My name is Cambria Byro, and I'm an outpatient therapist here at HopeSpoke. Today, I'll be talking about attention deficit hyperactivity disorder, or ADHD. ADHD is a common neurodevelopmental disorder that is most frequently diagnosed in children. Upon the creation of its label, ADHD was originally called hyperkinetic reaction of childhood. It wasn't until the 1960s that the American Psychiatric Association formally recognized it as a mental disorder. And in the 1980s, the diagnosis became known as attention deficit disorder with or without hyperactivity. The APA released the fourth edition of the DSM in the year 2000. This edition established the three subtypes of ADHD that are still used by healthcare professionals today: combined type, predominantly inattentive type, and predominantly hyperactive impulsive type. The symptoms of ADHD in children and teenagers are well-defined, and they're usually noticeable before the age of 6. These symptoms can cause significant problems in a child's life, such as underachievement at school, poor social interaction with other children and adults, and problems with discipline. The main symptoms of ADHD are inattentiveness and hyperactivity and impulsiveness. The main signs of inattentiveness are having a short attention span and being easily distracted, making careless mistakes, for example, in schoolwork, appearing forgetful or losing things, being unable to stick to tasks that are tedious or time-consuming, appearing to be unable to listen to or carry out instructions, constantly changing activity or task, and having difficulty organizing tasks. The main signs of hyperactivity and impulsiveness are being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, interrupting conversations, and little or no sense of danger. Boys are more than twice as likely to be diagnosed with ADHD than girls, but girls are not necessarily less susceptible. Women with ADHD are likely underdiagnosed for a variety of reasons, including some differences in symptoms and an unequal focus on boys in research studies. According to researchers, girls with untreated ADHD are at risk of low self-esteem, underachievement, and problems like depression and anxiety. They're also more likely to get pregnant and start smoking while still in middle or high school. What's worse, girls with untreated ADHD will typically carry their problems into adulthood. Women with untreated ADHD are also more likely to have children with ADHD. In fact, many women finally receive a diagnosis when their children are diagnosed. For older children, the best treatment is often a combination of behavior therapy and medication. But for children under 6 years of age, experts recommend that ADHD be treated with therapy first before trying medication. Behavior therapy is the recommended treatment for ADHD in children under 6 years of age. The type of behavior therapy that is most effective for this age is parent training in behavior management, meaning that therapists work with parents and teach them the skills needed to help understand how ADHD affects their child. Parent training in behavior management is used to help change problem behaviors by building parenting skills, improving the relationship between parents and their child, and helping children manage their own behaviors. Children who have ADHD act in ways that are often challenging for parents. Children may forget the things that they are told, they might be overly active, and they might act before thinking. They might not be able to receive positive attention the same way that other children can. They tend to misbehave and they might be punished more frequently than other children. Even if children with ADHD really try to follow the rules, they might not be able to. This can have a negative impact on their self image and cause them to give up trying or to act up more often. For someone diagnosed with ADHD, it can be really hard to manage all of those big feelings and thoughts. Here are some tips on how to navigate school and relationships with ADHD. Sit in the front of class to limit distractions. Turn off your phone while doing homework. This will keep you from being distracted. Talk with your teacher about your ADHD. Some schools give students with ADHD extra time to take tests. Some students benefit from smaller class sizes. Others need tutoring help. Your teacher can help you plan what's right for you. Let friends know what's going on. Sometimes we blurt out things and regret it later on, or we do silly, impulsive things. If this happens to you, let your friends know that sometimes you say things without thinking them through. Apologize if you have hurt someone's feelings and try to be extra careful in new situations. Use tools that help you stay organized. Keep track of your assignments in a homework notebook or on a phone organization app. List the books and assigned readings you'll need to bring home. Set phone reminders for classes and other appointments, or write them down in a planner. Get plenty of exercise. Exercise can help people who have ADHD. If you feel hyper during school, talk to a teacher about taking activity breaks so that you can stay focused and concentrate better when in class. Take activity breaks often while studying or doing homework. Practice relaxation and meditation. Following a regular meditation and mindfulness practice helps people train their attention and focus better. Take pride in the things that you do well. Having ADHD is just one part of you. Make time to do the things that you enjoy and develop your interests and talents. Here at HopeSpoke, we provide a comprehensive array of services designed to meet the mental health needs of those we serve, including crisis and residential care, extended day treatment, outpatient programming, and school programs. For more information, please call 402-475-7666. And be sure to check back in with HopeSpoke's video series for more information and education. We will have a new topic for each installment, so be sure to keep an eye out for future videos. Thanks, and bye for now.